Alexia Mannon Sr. is 27 and healthy, the type of person who might be most tempted to forego health insurance if Republicans enact a tax bill that repeals the Affordable Care Act's requirement that most Americans have coverage or pay a penalty. But Ms. Mannon Sr., a graduate student in Miami, said she would hold tight to her coverage, at least as long as she keeps getting nearly $5,000 a year in government subsidies to pay for most of it. The reason why I'm currently in the ACA is not because I want to avoid the tax penalty, she said. It's because of the what if. If something happens and I leave the hospital with a $10,000 bill, it's a lot of money that I don't have. People like Ms. Mannon Sr. complicate the argument of Senate Republicans who are counting on repeal of the so-called individual mandate to free up hundreds of billions of dollars to pay for an array of tax cuts to corporations and individuals. They are assuming that without a mandate, many people would no longer buy insurance, so the government would spend billions of dollars less on the subsidies the health law provides to help those under a certain income level pay their premiums. The nonpartisan Congressional Budget Office has estimated that doing away with the mandate would result in nearly 13 million more people without insurance and federal savings of $338 billion by 2027. But polling data, analysis from a private forecasting agency and interviews with people who buy coverage through the Affordable Care Act marketplaces suggest the savings could be far less, largely because many people who qualify for the subsidies will still want to take advantage of them. Even the Budget Office is revising its estimates and has predicted the new numbers would be smaller. In a survey this fall, the nonpartisan Kaiser Family Foundation found that just 7% of people who buy insurance on the individual market said they would go without coverage if the mandate were no longer enforced. A majority said the mandate was not a reason they bought insurance. Only about 1 in 5 said it was a major reason. It's consistent with other work we've done showing people want and value health insurance, said Liz Hemmel, Kaiser's Director of Public Opinion and Survey Research. Especially in the marketplace, where so many are getting government help to pay for that coverage, I think that's a bigger motivating factor for them to get it than the mandate. The mandate, in other words, may not be much of a stick, but the subsidies are a tempting carrot. A new analysis from S&P Global Ratings projected the 10-year savings at $60 billion to $80 billion, saying that the number of uninsured would drop by only 5 million at most by 2027. Most people buying insurance are doing so not because they fear the mandate, the agency said, but because they get a subsidy that meaningfully offsets the cost. Nearly 60% of people who buy their own insurance receive subsidies, S&P Global estimated, including 84% of people who use the Affordable Care Act marketplaces. Repealing the mandate was not a part of the tax legislation that passed in the House last week, but Senate leaders added it to their bill, both as a step toward making good on their promise to dismantle Obamacare and as a way to generate a big pot of revenue.